All right, happy Tuesday, everybody. We are chatting about PTSD and treatment. And this one is kind of cool because you're going to realize there's more than just one way to treat somebody with PTSD, which I think everyone, maybe not everyone, but when you go through it, you only think, well, that won't work for me, or that's not going to do anything for me. I don't like talking about it, or, all the regular excuses that you may get from it. But really, there's a ton of different therapies that you can have your spouse or that you personally can go through. So I'm going to chat a little bit about that. This isn't just limited to different therapies here, but the only ones. But these are like the most prominent ones. So the first one is PE. It's called prolonged exposure, and that's it helps you gain control of negative feelings and do things you have avoided since your trauma. I've had to do it. Part of my other ones, worth it, but it sucks. I'll tell you that. Okay, number 2 is CPT. So cognitive processing therapy. It helps you reframe your negative thoughts, and you talk and you write about those thoughts. EMDR is eye movement desensitization and reprocessing, which helps process and make sense of your traumas, helps you recall traumas, while paying attention to some sort of objects, whether it's a pen or a finger, going back and forth. It could be a pen, light, finger tone, anything like that. But it helps you recall the traumas, so then you're more desensitized to the actual trauma, so your body doesn't react in the way that it does due to your PTSD. So those are just some of the strongest trauma evidence psychotherapies, but just know that not all of them work for every person. So you may have to try one or more. The most important thing to remember, though, however, is that you are trying, and if you are trying to be better and you're giving it the effort that it deserves, just know that you are going to find something and you will get better and you'll get used to your new norm. So hang tight for the rest of the week as we continue with PTSD and treatment.